Hello, I'm Peter Kistler from the Alfred Hospital in Melbourne, Australia, and it's my great pleasure to provide a brief synopsis for our upcoming paper in the journal entitled Impact of Mitral Regurgitation on Outcomes of Catheter Ablation for AF with Left Ventricular Systolic Dysfunction. This paper is going to be presented by first author Louise Segan at the Heart Rhythm Society meeting here in San Diego. The background for this paper was really based on fairly strong evidence supporting the role of AF ablation in patients with preserved systolic function in reducing mitral incompetence, but a relative paucity in the presence of systolic dysfunction. Additionally, we've had concerns that patients with significant mitral regurgitation are less likely to be referred for AF ablation, given the belief that these patients don't get a particularly good outcome. We present 235 patients, largely drawn from clinical trials that we've been involved with in recent years. The mean age of the patient population was 63, with on average class 3 heart failure symptoms. The baseline characteristics between the group with mild versus moderate to severe mitral regurgitation were relatively well matched, aside from more severe systolic dysfunction in the group with more severe mitral regurgitation and more associated tricuspid incompetence. Importantly, at 12 months following catheter ablation, we saw no significant difference in the success of the procedure, with recurrent atrial arrhythmias in around 43% in both groups, irrespective of the severity of mitral incompetence. With changes in left ventricular dimensions, we saw significant improvements in the degree of mitral incompetence in up to 89%. And that these tended to be more related to reverse LV remodeling rather than atrial remodeling. So the conclusion from our study is that patients with AF and LV systolic dysfunction should be strongly considered for AF ablation, irrespective of the degree of mitral regurgitation, given excellent outcomes both in freedom from AF and recovery of mitral incompetence.